Hi, Dr. Frank Johnson from Sports Medicine Ultrasound. I'm going to demonstrate an injection of PRP into two different ankle ligaments, one ankle joint, and then I think we've got an elbow to take care of as well. The way I find the ATFL, the anterior talofibular ligament, which is the most frequently sprained ankle ligament, is I place the distal fibula in the middle of the screen here. With the probe parallel to the bottom of the foot, I then rock the front end or the distal end of the transducer onto the talus. And then with some slight movements, we see the ATFL pop out. It's a bit hypoechoic, so nice and dark. Deep to that, we can see a little bit of the articular cartilage of the talus, and we can almost see a little triangle that if you wanted to get into the ankle joint proper, you could simply drop your needle into that little triangle. Today we're actually trying to inject into the ligament. Now, just sitting on top of the ligament are some arteries just over here on the left of the screen. And to line this up for an injection, I simply move the transducer out of the way, so I've got a really short distance to travel. I'm going to activate my voice activation, increase depth, increase gain, increase gain, increase gain. I'll now take a small bit of anesthetic. Little poke. I don't know why I say little poke, but I just seem to do that every time. I'm super confident that that traveled exactly to where I want it. Next thing I'm going to do is grab my needle for injection of the PRP. Having already anesthetized the skin, I go through the same pathway. And there you can see the needle tip inside the ATFL. So just a small little puff. We're only going to inject about 1 milliliter here. By passing through, you can see the ATFL is actually holding together reasonably well. Some people will have it kind of flap open, showing a really high-grade tear. And I can sense some opening indicating a prior tear. And if I pass through, a little bit goes into the ankle joint proper. Okay, that's the first bit. Now to go up to the high ankle sprain, or the AITFL. The way we get to the AITFL is we leave the distal fibula in view, and we simply rotate the distal end of the probe about 90 degrees to the north. And all of a sudden, here we get a 3-bone view. We get fibula on the right, tibia on the left, talus happens to be seen below. And what we can see here is we can actually see a thickened AITFL. This is an old sprain. For this one, I'm going to activate my center line, turn on my voice recognition, center guide, decrease depth. Using the center line indicator on the probe, because some probes don't actually have the center line indicator. Again, just a small amount of anesthetic in the skin, down to about 45 degrees. Sorry about that, but that's the sore spot. You can see the needle getting into that ligament there. Okay, small amount of anesthetic. Okay. And this is an out of plane technique. So again, the needle will be showing up as a white dot. You won't see the whole length of the needle. But this is a super helpful needle approach called an out of plane technique that can allow you to get into lots of different tight spots. And we're almost done. Having kind of the way I think about this is it's an injured ligament, and I'm trying to fill up the sponge of the injured ligament. And it's holding on really tight. Like, although it's sprained, it's structurally sound. The final spot we're going to is the posterior aspect of the tibiotalar joint. This one's a little trickier to see with ultrasound. It's actually best seen with fluoroscopy. Increase depth. And this one's best approached from posterior to anterior. So I've already cleaned the skin here. I've got that disinfectant on there. And again, although I can't see my needle perfectly because the surrounding tissues are also nice and white, I can see the needle path by just making some gentle, small oscillations, and I can see it's in the right spot. And there we go, there's my injection into that joint. Excellent. So there we are. That's the ankle joint injections and ligament injections. Now we're going to move on to the elbow.